Most drivers show up to their DOT physical having skipped breakfast for no reason. Here's the truth. You almost never need to fast before a standard DOT exam. The DOT physical is a medical fitness evaluation. Your examiner is checking your vision, your hearing, your blood pressure, your medical history, and doing a physical exam. There's also a required urine test. What's not in there, as a standard requirement, is a fasting blood draw. So unless someone specifically told you to fast, go ahead and eat your normal meal before you come in. Now, there are situations where fasting might actually apply, but they're separate from the DOT exam itself. If the clinic is running additional lab work alongside your physical, things like a cholesterol panel or a fasting glucose test, that's when you'd need to skip the meal. The CDC notes that a standard cholesterol test typically requires 8 to 12 hours of fasting beforehand, but that's add-on testing. It's not part of the FMCSA's core medical exam requirements. If you're not sure whether your visit includes that kind of extra lab work, call ahead and ask. One thing that trips a lot of drivers up is the urine portion of the exam. The urinalysis in your DOT physical is a health screen. The examiner is looking for things like sugar in the urine, which could point to diabetes concerns, or protein, which might flag a kidney issue. That's it. It is not a DOT drug test. Drug and alcohol testing runs under a completely separate set of federal regulations. Different process, different rules. Because you do need to provide a urine sample, don't show up dehydrated. Drink a normal amount of water. You don't need to overdo it. Just don't skip fluids all morning and then struggle to produce a sample at check-in. Here's something else worth paying attention to. Your DOT exam includes a blood pressure reading, and what you do in the hour before that reading can affect the number. The CDC and the American Heart Association both advise avoiding caffeine, cigarettes, and hard exercise for at least 30 minutes before a blood pressure measurement. Eat normally, but give yourself that buffer before the cuff goes on. And come prepared. Bring a list of your current medications, name, dose, who prescribed it. If you wear glasses, contacts, or a hearing aid, bring those. If you have an ongoing medical condition your examiner will need to review, bring the documentation. Bottom line, eat your breakfast, drink some water, skip the caffeine right before you walk in, and call ahead if you're unsure whether your visit includes any extra lab work that actually requires fasting.